Hello, I'm Dr. Karen Landers with the Alabama Department of Public Health, and today I'm joined by one of our new colleagues, Dr. Wes Stubblefield. Dr. Stubblefield and I are both pediatricians, and in this pandemic, we believe that it's important for us to share not only our pediatric knowledge and expertise, but also some of our personal experiences as parents to kids during this particular difficult time. And we know that children can contract COVID, children can become very ill with COVID, children can spread COVID to other people. So we want parents to have factual and up-to-date information, and we encourage parents to speak with their pediatricians about advice during this pandemic. Really, do not be looking at misinformation on the internet or other social media sites, but look at vetted sources such as the American Academy of Pediatrics in order to be able to make informed medical decisions about your child. I'd like to ask Dr. Stubblefield to speak to his experience because he's most recently has been in the clinical setting taking care of children on a daily basis. Dr. Stubblefield?
One thing that we would see a lot of in our office were children that had minimal symptoms, but were a part of a large family and an outbreak among close family members. And so we know that it's being transmitted in the home. That overall the children are recovering well. But we also vaccinated children, and which is an important part of those strategies that we talked about before. And the good thing about when we vaccinated children so far in our clinical experience is that they had very, very mild symptoms from the vaccine. So that was very encouraging. We did see children that were particularly ill with COVID. And we know that our colleagues in Birmingham and Mobile and Huntsville at our children's hospitals are seeing very, very sick children with coronavirus.
You know, Dr. Stubblefield, both of us have been asked many times about the impact of this pandemic on children in terms of really the mitigation standards that had to be put in place. And I know I've been asked a lot about children wearing masks and really why children had to wear masks and why is this important and could this be harmful to children? You know, my answer has been really to all the parents that I've talked to, grandparents and other caregivers, is that if we look at masks as just one of the ways that we reduce COVID, and we know this is an important way to catch those respiratory droplets, but if we look at masks, we have to remember that there is a lot of information that shows that masks are very, very helpful. And there is no information to show that masks are harmful. And yet we know that, again, some parents have objections and concerns about masks. How did you address those when that happened in your practice?
So it's important to focus, like you said, on both the positives of mask wearing and the absence of any major negatives. We have evidence to suggest that children do just as well developmentally and socially, even with masking, because of nonverbal cues that we use when we communicate. And so they're able to construct together those emotional responses, and so those don't seem to be affected. There's no evidence that mask wearing contributes to any increase of carbon monoxide in the blood or carbon dioxide in the blood, which people have talked about. We know that there are some places in the world where mask use is very common and has been for a long time, even before the pandemic. We also know that healthcare workers wear masks on a regular basis. So I think taking all that information together and instructing parents that it's a very important mitigation strategy to keep our kids healthy, to keep them from spreading it to other people, like you mentioned, because as we know, children can often have asymptomatic disease and show very minimal symptoms and spread that disease to other susceptible people that can have very bad outcomes.
And again, I think just continuing to emphasize to parents that when we look at mitigation for COVID, obviously we are doing all we can to protect a certain population of people who can't be vaccinated. Certainly at the moment, we can't vaccinate people under 12 years of age. We know that there is discussion and potential presentation of this data to the FDA by Pfizer. But again, at the moment, we don't have a vaccine for kids under 12 years of age. You mentioned that you vaccinated in your practice, and I've had a lot of experience in the vaccine world as well, talking about COVID vaccine and really being one of the medical consultants to our team about vaccine and ensuring that if persons had questions about vaccine while they were in the clinic, we could answer those. Tell me a little bit about your practice's vaccine experience, and again, as far as giving that not only to children and adults, and how that went, and really how you would continue to advise people about the use of vaccines.
So, so in our practice, every practice is different, as you know, because of storage requirements for the different brands of vaccine and what's currently approved under for each different brand. So in our practice, we were limited to one brand, and so that brand limited us to 18 and up. And so we had a fair number of patients who were very eager to get the vaccine. And we made it part of our routine practice that when we were talking to parents or older children and at potentially school age or college age adolescents that were getting to the 18-year-old, we would ask them about their interest in the COVID vaccine as part of their maybe back to college regimen as we were seeing those checkups. And then, of course, talking to parents about what's coming. We would talk to parents about before the emergency use authorization went down to 12. When it was, when it got down to 12, we talked about that, and then we talked about the fact that it would, the next group probably would be that 5 to 11 group, and that was currently under study. And reassuring parents that as we've vaccinated children, we've known that there are overall very minimal side effects, and the vaccine seems to be very effective and shows robust responses even in younger children.
I think when we speak about vaccine, again, both of us have a lot of experience talking to parents about childhood vaccines because that's so much a part of what we do now. You know, in my career, I've seen a lot of diseases essentially go away. I'm probably one of the few physicians still practicing that's ever actually seen a case of measles because we really don't see that very much in the United States. And certainly I know that diseases such as Haemophilus influenza type B and pneumococcal disease have both been significantly impacted by vaccines. And then more recently, over the last 20 or so years, we've seen a lot less varicella. But coupled with that, we have seen in our practice related to routine childhood vaccines an increase in parental hesitancy related to vaccine products. And I think that has been brought into light much more with the COVID vaccine. So tell me a little bit about vaccine hesitancy and how you handle that and how you see that in your practice setting. And then we will talk a little more about the specific concerns that some people have had about COVID vaccine.
Sure. So, so you're exactly right. As pediatricians, we can't help but talk about vaccines because it is such an important part of what we do. And parents have, I was in practice for 14 years, and over my 14 years, I've talked to many vaccine hesitant parents, vaccine resistant parents, parents worried about a particular vaccine or vaccines in general. And what we found over time is that what makes the biggest difference in my personal experience and in other experiences from pediatricians across the country is to provide that strong recommendation. Number one, that I wouldn't do anything, that I wouldn't recommend anything to you that I wouldn't recommend for my own family, for my own 19-year-old daughter, and anybody else that I would talk to. So that strong personal recommendation, making sure that we had a consistent message in our practice that we are pro-vaccine, that we want to give the vaccine for the best health of our children. Making parents comfortable that they can come and ask questions because we have an open practice where we can have parents and they can bring in their concerns and they can talk to us about what they've read and we can help them sort through that information because that's the benefit of having the educational background is that we can take that information and then put it into context and then talk about what that means for their particular family, knowing that it is ultimately the parent's decision to make that decision for their children. And every parent always wants the best for their children. And so when parents come to me and have questions, I look at that as a good thing because they're protecting they're doing the best they can to protect their children. So providing that strong personal recommendation from a trusted source, that physician that's seen their children over and over again, and then having that unified approach approach to the vaccine is probably what makes the biggest difference for parents.
You know, in my experience, again, through the years, having been in a situation where I've seen a lot of vaccines come onto the market, you know, I've shared with parents and reminded people, especially in this COVID-19 situation, is that really when you look at vaccine and vaccine products and the history of vaccine safety, I mean, vaccine safety has been paramount in the entire development of other vaccines for children and as well as adults. And to keep in mind that if you really look at any potential problems and issues related to the vaccine, that any potential problems with the inactivated vaccines has been picked up well before a couple of months. So, I mean, obviously we've got really coming up on about 9 months of experience giving the COVID-19 vaccine, and some of the technology used in developing these vaccines. Again, keep in mind this technology was there for the purpose of developing a vaccine in the event of a pandemic. And so really we're doing exactly what was expected in having a vaccine that we can rapidly respond to an emerging infectious disease. I mean, I want to drill down on some of the concerns that you and I were discussing as pediatricians and really kind of take this into where we are as parents, and again, of, you know, parents of young adults, and really sharing our personal information as a final part of this. You know, one thing is, obviously as pediatricians, we're on the receiving end of the situation when women have babies. I mean, obviously, you know, we get to take care of the babies, and yet we have shared with our OBGYN colleagues our concerns about preterm labor and other poor outcomes, and I think they have joined so well with us in trying to prepare the best messaging that we can for pregnant women. So talk to me about the study that you were reading and some of the information that you have been seeing related to vaccines in pregnancy. So
as you know, these vaccines, we've given out hundreds of millions of doses in the U.S. alone. And they are actively studying the potential effects of the vaccines on both pregnancy and pregnancy outcomes and outcomes of mothers infected with COVID. Right now in our state, we have had mothers that have been very sick with COVID, in the ICU with COVID. I think right now we have mothers in the ICU with COVID by pregnant women. So we know that pregnancy affects women in different ways, particularly their immune system. And we know that women that are pregnant, that infected with COVID, can have very significant outcomes, which can lead to things like stillbirth and premature birth, preeclampsia, admission to a NICU or a neonatal intensive care unit, outcomes such as those, which are horrifying to parents, and hard on the babies, because we all know what prematurity and prenatal stress can do to infants in their development and long term. So we know that COVID can affect pregnant women. We have a fair number of women who have been vaccinated now. They've just released some large-scale studies looking at women at rates of miscarriage in women who have both received the vaccine and women who have not received the vaccine, and those rates aren't any different than what has always been known historically. So the vaccine does not seem to be associated with any sort of adverse pregnancy outcomes. We know that the mRNA technology, it degrades very quickly inside the muscle. It's very unlikely that would reach the fetus. And we do know that moms transfer antibodies to their infants through the placenta to protect them in their few months after birth against the COVID disease. So you've got moms that are transmitting good antibody to their baby to keep them protected, and potentially from getting very sick, because these are babies that aren't eligible for a vaccine for many years. So, we have women that are also getting pregnant every day after getting the vaccine. We have information that has been studied over time, starting with healthcare workers that were pregnant and looking at outcomes, and those outcomes have been comparable to baseline outcomes. So in all the data that they've collected and are continuing to collect on on women in pregnancy, women getting the vaccine in pregnancy, either pre-pregnancy or during pregnancy. We've not seen any adverse outcomes. And biologically, there doesn't seem to be any plausible mechanism that should affect any current or future fertility in women with this vaccine.
You know, I think when we talked about this early on, both of us were deeply concerned as pediatricians that we, again, continue to have open dialogue with parents and that we continue to encourage parents to ask us questions. And again, in my many years in pediatrics, that has been really, to me, the most important part of what I do, and that is to educate and inform and help parents to bring up healthy children. You know, we're both parents, and our children obviously are a little bit different in terms of age groups, but I think that just looking at my role as a pediatrician through the years, I've always said to parents, I would not give your child any treatment or management that I would not give to my own children. And I would treat your children in the same manner as I either would treat my own children or would want my own children to be treated. I mean, I think that's a part of our ethical charge as physicians, and again, taking care of future generations. And, you know, I would just like to speak to the issue of COVID-19 vaccine with my own family, again, because my children have given me permission to talk about their vaccine experience. And, you know, first of all, I'll say, you know, I have two daughters, you know, one that's 32 and one that's 36. So obviously, you know, they're young adults and they have concerns about, you know, their own future and again, protecting themselves from this particular virus. And both of my kids were very anxious to receive the vaccine. One, because my older daughter is actually a physician, so she wanted to receive the vaccine as early as possible, as soon as it was available. And my younger daughter very much wanted to receive it, but recognized that she had to wait her turn because she did not qualify. But again, just talking to both of them, they had read information on their own. And again, one is a physician and one as a non-physician, and determined that for their own health, for their own well-being, and for the well-being of their family and their future, you know, they determined that this was appropriate for them. And again, both being women, they wanted to add their voice to women's health and to advocate for young women, not only in terms of, again, preventing COVID disease, but also preventing any potential situations if women were pregnant from having poor outcomes. And then finally, just as women wanted to add their voice to the information that they believed based upon what they had read, that this vaccine did not affect fertility and did not have long-term outcomes. So again, you know, as a parent, obviously, you know, I think you transition very much to a consultant when your kids are the age that mine are. But again, as a physician, I was very pleased that they looked at this in a thoughtful manner and made their own decisions, and again, waited their turn as they were appropriately designated to receive the vaccine. You know, I had one of my children to take Moderna because that was what was available. I had another child to take Johnson & Johnson because that was what was available. Now, she was a little excited about taking Johnson & Johnson because she only had to take one dose and it fit into her schedule. Mm-hmm. So again, I think it's important that we not only identify as parents and caregivers with our own family, but we identify as pediatricians and we look back on our own experiences as both parents and pediatricians and see the progress that our children have made and how far they have come, and the thoughtful nature that that they put into their own vaccine decisions. And of course, both my daughters are married, so it goes without saying that if they were getting vaccinated, so were their husbands. And apparently the husbands were also very interested in getting their vaccine, and certainly wanted to contribute to really the greater good, not only getting vaccinated, but also protecting the community. Tell me, you have a daughter that's younger, and really a couple of things. One is that she was actually in school when COVID hit. Mm-hmm. So how was that? And also a little bit about her decision about taking vaccine.
So she was in that, she was a senior when COVID hit, and so she missed the very end of her senior year, and a lot of what goes on at the end of senior years in terms of, get-togethers and all the things that we all did when we were seniors, and so she then transitioned to college and had an interesting first year in college, and now is in her second year. And so helping her through that as a older child, I didn't have to go through a lot of what the parents of younger children had to go through with their children of doing virtual school. She was able to mostly just have an extended summer break. But so that was a time when we got to be together. We all isolated together when we all had the disease, and so we had a lot of time together that summer. And we actually had to send home our foreign exchange student to Belgium because of COVID, and so she didn't get to finish her senior year with us either. So we had a lot of heartbreak during that time, but we all transitioned well together and saw her off to college. And in terms of her experience, she's in a different place. I mean, as a very young adult, just not even 20 years old yet. I know that she relies on me she trusts me to tell her what she needs to do in terms of her health, because I'm dad and I'm also a pediatrician, and so when it came to recommending a vaccine for her, I was not hesitant at all, because I knew that it was the best decision for her. And she's not in a place where she can, or she at that time wasn't in a place where she could research it herself. And she was really still very much in that mindset of Dad, just tell me what to do and I'll do it. And I think that as a parent, that's a lot to think about my own role as her dad. But the fact that she trusts me enough to say, if you say it's the right thing to do, I'll do it. And so my hope is that with that experience for her, that she has an increasingly better years of college, and then moves on to be a successful adult and gets to have all the opportunities she can have as a young woman and a family and all the things that she wants. And I trust that she can have that, because we've been able to keep her healthy with things like vaccines. I mean, obviously vaccines for us are one of the greatest public health inventions of all time. Clean water vaccines, sanitation, those are all the top three. Antibiotics. We live very, very healthy lives because of these things, and the COVID vaccine is no different. And I think what people will see is that over time, the mRNA technology will be used to make new and inventive vaccines that may be able to roll out quickly, because, like you said, that technology has been around for a while, and it was able to be used and put a vaccine in rapid development. The other nice thing is that everybody who's received a vaccine is essentially being studied, because they're putting their information into the VSafe program, and so we're maybe kind of all in a very, very, very large clinical study. So this vaccine is being studied daily because it's being given daily, and it's being studied over weeks and months with every dose. And so we are accumulating mountains of data that further just reassures us that we're doing the right thing.
In closing our conversation today, again, I think our overall goal was to not only share our general concerns as pediatricians, to encourage parents to have dialogue, but also to share our family experience. What is the one final message that you would like to deliver to the parents of children here in Alabama as we continue to work toward the future in restoring us to a level of normalcy?
I think the one thing that I've always wanted parents to know is that is that as an Alabamian, as a person born and spent almost all of my life in this state, someone who cares passionately about what I've done for 14 years and then what I plan to do as now a public health professional. I want people to know that I'm here for them. I'm a part of something greater, and I surround myself with people that are passionate about taking care of Alabamians, because that's what we're in the business of, is making our state healthy and successful and better in every way. So I want people to know that that this is a calling and a passion, and that I, as a practicing pediatrician, I took care of children for years and years, and maybe some of those people might watch this, and then as a dad, I've taken care of my daughter, and I will continue to be here for Alabamians, and I will work with the data, work with people. I will listen to everything and read everything I can to make sure I'm as knowledgeable as I can be, and pass only that information on that's going to make us better and stronger, and never hide anything from anyone.
You know, I think that, again, is really a very, very good capsule of where you are as, again, a younger pediatrician and a younger public health professional. And I would like to just build upon that to remind parents that, you know, my entire life as a professional has been to improve the health and well-being of the citizens of Alabama, and specifically focusing on children, and certainly in this pandemic being the voice of the Alabama Department of Public Health, and really ensuring that the information that we provide is factual and science-based, but also providing that in a manner that persons can really understand that information and translate that information to where they are in terms of parents. And again, just keeping that dialogue open and keeping the conversation going, because all of us want this to be over. All of us want this to be behind us, but we recognize that we cannot do this as individuals. We can't even do this as professionals. We have to do this as one state and one voice. And as something I mentioned yesterday, our voice not only has to be for ourselves, but it has to be for the children of Alabama. So thanks so much for speaking with me today, and welcome to the public health family.